Join our monthly online Zoom course for discussions, practice, and supervised training. We also offer special one-on-one Zoom courses for personalized guidance. For more tips, watch our videos and subscribe to our YouTube channel. Thank you.
Welcome back to the deep dive. Trying to get your head around complex medical stuff these days can feel, well, a bit much, can it? There's just information everywhere, and honestly, it's hard to know what's what. So that's what we do here, give you that shortcut, using really solid sources to build a clear picture. Today, we're diving into motor neuron disease, or MND. Our goal is to walk you through it, what it actually is, the symptoms, treatments, and really importantly, the support that's out there. By the end, you should feel, well, properly informed.
Yeah, and the sources we've drawn on are excellent, actually. They cover the medical science, how it's diagnosed, but also, critically, what it's like to live with MND. Getting that clarity on such a significant condition is, well, it's vital, isn't it?
Absolutely. So let's start unpacking it. What exactly is motor neuron disease?
Beyond the name. Okay, so fundamentally it's about muscle weakness, but it's not static. It gets progressively worse, usually over months or years. It is, unfortunately, usually life-shortening, and right now there isn't a cure. But, and this is key, there are treatments available to help manage the symptoms, really help. That's right. And the why behind it involves the motor neurons. These are the nerve cells in your brain and spinal cord, the ones telling your muscles what to do. In MND, these motor neurons basically stop working properly. They degenerate. And when that communication breaks down, you see the muscle weakness, the wasting, all the symptoms start to appear because the signals just aren't getting through effectively.
And who does it typically affect? The sources say it can be adults of any age, but it's most common in people over 50. The early signs, though, they can be quite subtle, can't they? Easy to miss almost. Things like stiff or weak hands, making it hard to grip things maybe, or weak legs and feet, finding stairs difficult, tripping up a lot, or that foot drop thing where you can't lift your foot properly. And also things like muscle twitches, spasms, or even painful cramps.
Yes, and that subtlety is a real challenge. What's quite striking is how those early symptoms, a twitch that won't go away, maybe feeling a bit clumsy, weak grip that can seem like other less serious things, or just, getting older. But the advice is clear. If you have persistent weakness or twitches or problems with grip or movement that just keep happening or last a long time, you really should see your GP. Getting checked early is important because even without a cure, starting symptom management sooner rather than later can make a difference to quality of life. It helps people adapt.
And as things progress, what happens then? Well, sadly, the sources indicate symptoms can become more severe. Problems with breathing, swallowing, even speaking clearly. You might also see things like producing too much saliva, drooling, and sometimes changes in mood or personality too. And eventually it can mean someone isn't able to walk or move independently.
It's important to stress, though, it really does affect everyone differently. Not everyone gets all the symptoms and how quickly it progresses. Well, that varies massively from person to person. That individuality adds a whole layer of complexity for the person and their family.
Right. So if someone has symptoms like these and the GP suspects MND, what's the next step? How do they actually diagnose it? I gather it involves seeing a specialist. A neurologist.
That's right. A referral to a neurologist is key. And the diagnostic process itself, it's often more about ruling out other things initially. So they'll likely do blood tests, specific tests to check how the nerves are functioning, electrophysiological tests. An MRI scan of the brain and spine is common too, but mainly to exclude other conditions that might cause similar symptoms, things like MS or a trapped nerve. The tricky part is, especially early on, there isn't one single test that just says, yes, it's MND. Confirmation usually comes as the symptoms develop and become clearer over time.
So it can be a bit of a waiting game, potentially quite an anxious one.
It certainly can be. And that period of uncertainty, waiting for confirmation, it can be incredibly stressful. Good communication from the medical team during that time is so important.
Yeah, I bet. Now, here's something I found really interesting in the sources. MND isn't just one single thing, is it? There are different types.
Exactly. And understanding the type is really important. There are 4 main ones, and they tend to affect different parts of the body first, particularly in the early stages. Knowing the type helps anticipate how things might progress and, crucially, helps tailor the support right from the start.
Okay, so what are they?
Well, the most common one is amyotrophic lateral sclerosis, or ALS. This usually starts with weakness in the arms and legs, so, tripping, dropping things, those are common early signs. Then there's progressive bulbar palsy, PBP. This one mainly hits the muscles in the face, throat, and tongue first. So slurred speech, difficulty swallowing, those are often the initial symptoms.
Yeah.
Third is progressive muscular atrophy, PMA. With PMA, the weakness often starts predominantly in the hands. Fine motor skills become difficult. And finally, primary lateral sclerosis, or PLS. This mainly causes weakness in the legs, though sometimes speech can be affected too. It generally progresses more slowly than ALS.
So understanding that specific type really helps focus the care plan early on.
Precisely. If it's PBP, for example, getting speech and language therapy and dietary support involved early is critical. If it's more limb onset, like ALS or PMA, then physiotherapy and occupational therapy focusing on mobility and daily tasks might be the initial priority.
Okay, that makes sense. Let's shift focus a bit then, connecting this back to the person's life. How does living with MND actually impact someone day to day as the condition progresses? We know it worsens over months or years, and the speed varies.
The impact is, well, it's profound. It touches nearly every part of life. Mobility is a big one, obviously. Many people will eventually need to use a wheelchair. Speech and communication can become very difficult, which is incredibly isolating. Assistive technology like communication aids becomes absolutely essential. Speech therapists are vital here.
And breathing and swallowing, too.
Yes, breathing difficulties can arise, sometimes needing support like non-invasive ventilation, especially at night. Swallowing problems, eating, drinking these can lead to weight loss and choking risks, so dietary advice, maybe different food textures, or even feeding tubes might be needed down the line. And it's not just physical. The sources mention changes in emotion, thinking, behavior sometimes, mood swings, maybe becoming more irritable or apathetic. There's even a link between MND and a type of dementia in some cases. And, of course, the impact on relationships, on family, it's immense. Carers need support just as much as the person with MND. One source mentioned families feeling like they were losing the person twice if significant personality changes occurred alongside the physical decline. It's incredibly tough.
That really brings home the need for comprehensive support, doesn't it? It sounds like a whole team effort is required. Physiotherapists, occupational therapists, speech and language therapists.
Absolutely. It's about managing symptoms proactively and maintaining the best possible quality of life for as long as possible. Even though there's no cure, the focus is very much on active management, easing symptoms, anticipating needs. The treatment plan is always tailored and evolves over time as the condition progresses.
So what kind of treatments and supports are actually available? The sources mentioned medicines.
Yes, there are medications to help manage specific symptoms, things like muscle stiffness or cramps, excessive saliva production, sometimes breathlessness or emotional ability where people laugh or cry inappropriately. And crucially, for ALS, the most common type, there's a drug called Riluzole. It's not a cure, but it can help to slow down the progression of the disease somewhat, potentially extending life by a few months and maintaining function for longer.
Okay. And beyond medicines, therapies and practical support.
A huge range. Physiotherapy is key exercises to maintain muscle strength and flexibility, manage stiffness, help with posture and pain. Occupational therapists help people adapt to daily living, finding new ways to do things, advising on equipment for the home, like handrails, ramps, stair lifts, specialized beds or chairs.
Mobility aids too, I suppose?
Definitely. Walking frames, wheelchairs, electric ones often become necessary later on. Help with personal care, washing, dressing, that becomes vital too. And as we said, speech and language therapists are crucial for communication assessment strategies, providing communication aids, from simple alphabet boards to sophisticated eye-gaze computer systems, plus dietary advice, maybe thickeners for drinks or different food consistencies to make swallowing safer.
And the emotional side.
Yes, very important. Talking therapies, like cognitive behavioral therapy, CB2, can really help people cope with the emotional impact, the anxiety, depression, the adjustment to living with a progressive condition. Support for families and carers is part of this too.
It sounds like care needs to be constantly reviewed.
It does. People with MND typically have regular appointments with their specialist care team, often every 2 or 3 months. These are chances to discuss any changes, any new problems, and adjust the treatment and support plan accordingly. It's an ongoing partnership. And while life expectancy does vary a lot depending on the type of MND and the symptoms, the care team can provide information and support around future planning if and when the person wants to discuss it.
We've talked a lot about the what and the how, but what about the why? What do the sources say about the causes of MND? Why do these motor neurons start to fail?
That's still the big question, really. The honest answer is, for most people, we don't know exactly why it happens. The motor neurons stop working, yes, but the trigger, It's unclear. It's thought to be a complex mix, probably a combination of genetic susceptibility and environmental factors. But identifying those specific factors is proving very difficult.
There's a genetic link sometimes, though, isn't there?
There is. About 1 in 10 people with MND have a family history of the condition. Specific gene mutations have been identified in some of these families, but, and this is important for the other 90%, there's no apparent family history. It seems to occur sporadically.
And even if you have a family history, it doesn't automatically mean other family members will get it.
No, not necessarily. The inheritance patterns can be complex, and genetic counseling is often recommended for families where MND occurs more than once to discuss the specific risks.
Okay, so it's clear MND is incredibly challenging, physically and emotionally. Let's end by focusing on where people can turn for help and support.
Absolutely vital. Firstly, the medical team, the GP, neurologists, specialist nurses, therapists, they are the core support. But connecting with others who understand what you're going through can make a huge difference. Peer support is powerful. Local support groups, online forums, these can be lifelines. And there are fantastic organizations out there. The Motor Neuron Disease Association, the MNDA, is a key one in the UK. They offer tons of information, practical and emotional support for people with MND, their families, friends, carers. Their website is mndassociation.org, and they have a helpline, too.
Right, that sounds like a crucial resource.
Definitely. And also the Brain and Spine Foundation. They cover a range of neurological conditions, including MND. They also provide information, a helpline, and help connect people to support groups. Their website is brainandspine.org.uk. Accessing these kinds of resources can really help people feel less isolated and more empowered.
Fantastic. So we've covered a lot, from those subtle early signs through the diagnostic journey, the different types, the reality of living with MND, the treatments, and importantly, where to find support. Hopefully, you now feel much better equipped with a real understanding of MND.
And perhaps something to think about after this deep dive. Given that the causes are still so elusive, this complex mix of genes and environment, what areas of research do you think hold the most promise for the future? Is it digging deeper into the genetics, understanding those environmental triggers, or maybe focusing on the cellular mechanisms like protein misfolding? Where should the focus be to really unlock conditions like MND?
That's a really powerful question to leave us with, something to definitely mull over. If you want to explore further, do check out the resources we mentioned. Thank you for joining us on the deep dive. We'll see you next time.
Join our monthly online Zoom course for discussions, practice, and supervised training. We also offer special one-on-one Zoom courses for personalized guidance. For more tips, watch our videos and subscribe to our YouTube channel. Thank you.